In today's changing healthcare environment, delivering efficient, personalized care in a cost-effective manner is an urgent priority.
When someone is diagnosed with cancer, we often hear that patients want a few important things. They want information, they want to know the plan, have confidence in that plan, and they want to get it going as quickly as possible. Our multidisciplinary clinics are built to accomplish those things for patients. It's an optimal way to provide care, and simply put, it's what's best for the patients. We offer several multidisciplinary clinics at Multidisciplinary Cancer Center for breast, lung, thyroid, and prostate cancer.
I'm pleased to offer my patients a multidisciplinary approach to their prostate cancer care. The multidisciplinary clinic space is really meant to take the burden off of patients who are recently diagnosed with cancer. It incorporates all of the treatment team in one place, so surgery, radiation oncology, medical oncology, and even things like cancer nutrition, physical therapy, mental health, all of the support systems that patients need in one clinic visit. I think the big challenge when patients get diagnosed with cancer is it's a little bit of a puzzle that they need to piece together with these different appointments spread out sometimes over the course of weeks. So what we try to do is put all of those pieces in place in one setting so that there's a much clearer picture when the clinic visit is over, what the treatment plan is, when we start, and patients feel confident and comfortable, kind of ready to get started. So what's unique about our clinic is that we do this all in a clinic with everyone present. Lots of places will do like a multidisciplinary tumor board where people behind closed doors will talk about patients, review their imaging, and come up with treatment plans. But that plan is usually presented to the patient by one person. We're unique because the entire team is there. The patient gets to meet everyone and gets to ask specific questions related to that facet of their care with the person that would be providing that to them.
I'm Jared Cast. I'm the Executive Director of Multidisciplinary Cancer Center. Multidisciplinary Care Clinic is a collaboration between physicians coming to one location for the patient. The experience is wrapped around the patient. The patient doesn't have to move. It's an investment in our patients and the program to provide the best high-quality care we can. We do this for multiple reasons, partially for the collaboration between the physicians. It's really important for physicians to be on the same page and be heading in the same direction for complex cancer care that we give here. We have patients that travel around the state and also have a shorter time that we want for them to be able to start their therapy. And if we can get all the specialists in the room at the same time, collaborating with that patient and working with that patient the same day, it's able to speed up some of that care that we give. From my standpoint, I've been to multiple cancer centers around the country. This is really the best possible way to manage very complex cancer patients that we care for.
I think the vast majority of our patients recognize the unique nature of the kind of care that we provide in these multidisciplinary clinics, whether from their own experiences because they're here for a second opinion, or because they've had friends or family members who have had a very different experience with their own treatment for cancer. They come here, it may be a little longer day than they would normally have, but at the end of the day, at the end of that experience, when they walk out of this building, they leave here with a unique understanding of what the problem is, what their options are, what our recommended treatments are, and why we recommend that particular treatment.
The Multidisciplinary Lung Clinic was created to address worrisome findings that the patient has encountered, to facilitate that process and help them through that in a timely manner. In our lung cancer clinic, there is a pulmonologist who will typically be doing a biopsy to determine what the abnormal finding is. And there will be an oncologist present, a cancer doctor, and this will facilitate a plan going forward if that finding turned out to be cancer. It provides a blueprint of what to expect. Having our nurse navigator just keep everything together, organize the possible biopsies, the diagnosis, it's really the ideal situation.
I'm very proud of the technology and the innovations that we have implemented into the cancer care, but truly it's the way that we care for the patients. The patient-centered care centered around multidisciplinary care clinics is exceptional. All of those providers huddle up before they see that patient. They get on the same page and they know exactly which provider is doing what and what aspect of care that they're taking care of. And that is a huge advantage and a huge reason why the care here at Hall Prime is different and truly an investment in the patient's care.
As you've heard, Mercy's Hall Prime Cancer Center offers multidisciplinary clinics for breast, prostate, thyroid, and lung cancers. We're developing additional ones for the most common cancers we see as well. Offering a survivorship clinic like we've begun is just another component to making sure our patients have quality care plans, access to providers, and the confidence they need during a trying time in their lives. As always, thank you for trusting Mercy with your care.